pharmaceutical companies hiking the prices of drugs. Martin Shkreli is the former CEO of Turing Pharmaceutical, who's responsible for hiking the price of at least one drug by 5,000%.
Are you going to change the price?
No.
Martin Shkreli, c'est un épiphénomène.
Martin Shkreli is a phenomenon. He illustrates that the system is broken and that the drug ecosystem is completely money-driven.
Let me ask you something simple. How many times have you heard about a pharmaceutical company doing something absolutely insane? Price gouging insulin, pushing addictive opioids, hiding side effects, and yet nothing happens. No arrests, no real punishment, maybe a fine, maybe a public apology, but nobody goes to jail. And the company keeps making billions. Why? Why does the government never actually crack down on pharmaceutical companies? Well, let me show you how the game is played. Big Pharma is one of the most profitable industries in the world. They don't sell gadgets or luxury. They sell survival. If you're sick, you pay. If you want to live, you pay. That's not medicine. That's extortion with a lab coat. Insulin, for example, was discovered over a century ago. Its inventors literally sold the patent for $1 because they believed it belonged to humanity. Today, a single vial in the US can cost over $300. Not because it costs that much to make. It costs about $5, but because the companies can charge whatever they want. There are no price controls, no government interference. And if you can't pay, too bad. Now, let's say a pharmaceutical company gets caught doing something illegal. What happens? Well, they might get fined. A couple billion here, a few hundred million there. It sounds big, until you realize that these companies make that back in days.
I'm honored to stand here today with dedicated colleagues from within the Department of Justice as well as beyond it to announce a historic settlement with Pfizer Incorporated, a pharmaceutical manufacturer, and its subsidiary Pharmacia and Upjohn company, arising out of civil and criminal allegations relating to Pfizer's allegedly illegal promotion of various drugs, most notably Bextra. In a combination civil and criminal settlement, Pfizer has agreed to pay $2.3 billion, the largest healthcare fraud settlement in the history of the Department of Justice.
In 2009, Pfizer was fined $2.3 billion for illegally marketing drugs, one of the biggest settlements in history. But that same year, they made over $50 billion in revenue. That's like you getting a $20 parking ticket after stealing a Ferrari. And guess what? Nobody went to prison. Nobody even got fired. It was business as usual. Purdue Pharma is another example. They made billions selling OxyContin, a drug they claimed was safe, even though they knew it was highly addictive. The result? Hundreds of thousands dead, families destroyed, entire communities wrecked by the opioid crisis. And yet the company just paid a settlement, declared bankruptcy, and moved on. The Sackler family, the people behind Purdue, didn't lose their wealth, didn't lose their freedom. They just disappeared into luxury. So again, why is this allowed?
How is it that we can have people that sit in the Food and Drug Administration and regulate private industry, and at the end of that regulatory career go in to work for the same industry that they purported to regulate? And sometimes for 10 times what they would make as a regulator.
Kind of kooky.
It seems to me like you would get arrested for that in another industry.
Yeah.
Right? I mean, if you did that in the securities industry, the banking industry, you wouldn't get away with it. And, you know, north of 70%, I think the number 74% of our nutritional research is funded by private industry. You know, we privatize the profit, but we socialize the expense. And by this, I mean, like, we socialize through the tax-subsidized medical system, Medicaid, Medicare, the expenses, right? So the expenses go onto the taxpayer, but the payments go to private industry. So we privatize the profit and we socialize the risk. And then the private industry that benefits from this doesn't even have a fiduciary to the patients that they serve. They actually have a fiduciary to the investor. And they can go to prison for not actually performing for their investor. They can't go to prison for not performing for their patient. So if I make a pharmaceutical that goes into your body, but somebody invested in my company to make that pharmaceutical, my responsibility is to them, not to you. So now you get harmed. I'm held harmless. But if I harm him by not selling it to you for the right margin, he gets to put me in prison.
It starts with what's called the revolving door. This is when people go back and forth between the government and the industry they're supposed to regulate. A guy works at the FDA, then he gets hired by Pfizer, then he goes back to the FDA, then back to Big Pharma, and so on. These are the same people writing the rules and cashing the checks. They know the system, they built the system, and they have no interest in changing it. Imagine being a referee in a boxing match where you get paid by the fighter you're supposed to monitor. That's what's happening. The watchdog is on the payroll. And it gets worse. Big Pharma spends more on lobbying than any other industry in the United States.
Drug companies and the insurance companies have spent $4.5 billion on lobbying and campaign contributions.
In 2022 alone, it spent over $350 million lobbying Congress. That's more than oil, more than defense, more than tech. And that's why lobbying is my next video. Subscribe to get the notification when I release it. What do they get in return? Laws that protect their patents, kill off generic competition, and keep prices high. Politicians don't bite the hand that funds their campaigns. Many of them rely on pharma donations to stay in office. So when bills come up that could actually hold these companies accountable, guess what happens? They vanish. They get revised. Or they die quietly in a subcommittee, never to be seen again. This isn't some conspiracy theory. It's openly documented, legal, normalized. And when a politician does try to push back, the industry unleashes an army of lobbyists, lawyers, and media consultants to crush it. Speaking of media, don't expect much help there either. Turn on the news and count how many pharmaceutical ads you see. Ask your doctor if this pill is right for you. In the US, drug companies are allowed to advertise directly to consumers. That means they spend billions buying airtime on television networks. And if a network makes a huge chunk of its money from pharma ads, do you think they're going to go hard on a story exposing those same companies? No, they won't. That's why most media coverage is shallow, safe, surface level. You'll get the occasional outrage segment, but never a sustained investigation. Never the kind of pressure that leads to real reform. Now, here's the part that really messes with people, because every time this comes up, someone says, but we need pharmaceutical companies. They make the medicines that save lives. And they're right. But that's exactly what makes this so dangerous. This industry hides behind the fact that they do some good. They create real treatments. They fund research. They save lives. But so do firefighters, and they don't bankrupt people for a bucket of water. It's not that medicine is bad, or that research is evil. It's that we've allowed a system to exist where healthcare is controlled by corporations whose only mission is to maximize profit. That is their legal duty. Not saving lives, not helping patients, just profit. And until we fix that system, until we put people before shareholders, nothing will change. You'll keep hearing stories of families going bankrupt because of medical bills, stories of people dying because they couldn't afford a drug that costs pennies to make, stories of executives getting richer while millions suffer. And the government will keep looking the other way, not because they're incompetent, but because they're complicit. They built the system to work this way, and it's working exactly as intended. So the next time someone tells you that justice is blind, remember, it can see just fine. It just knows who signs the checks.